knowing what part of a tumor to sample so we know the fingerprints of that tumor. It's key to the future of personalized medicine. Oftentimes we have to know what we're doing before we actually go and kill it with these techniques. And we often do biopsies before the treatment or on the same day as the treatment to know exactly what's going on and what we're dealing with. So what's the genetic fingerprint of that tumor? What markers is it expressing? How's it going to respond to drugs? Which opens up another door towards the personalization of oncology. So personalized medicine, deciding what drugs are going to work for what patient at what time. Right patient, right drug, right time. And knowing that is key to the future of personalized medicine. Knowing what part of a tumor to sample so we know the fingerprints of that tumor. Getting that information requires knowing what part of the tumor is potentially most metabolically active. And noise goes in, noise comes out. Information is only as good as what you get from a biopsy, and we really pride ourselves on being able to tame the beast of cancer heterogeneity. What do I mean by that? Every tumor is not all the same fingerprint, genetic profile, or proteins expressed. So if you have a tumor, we can often use imaging, PET scan, metabolic imaging, for example, to decide what part of the tumor is most metabolically active and might have the most likely fingerprint, which will best correlate with the drugs we select, or will best tell us whether the drugs we're giving are actually working, and best tell us how to advise that patient about prognosis. So being able to use this technology, this medical GPS for biopsy, lets us sample the appropriate part of a tumor as well from a diagnostic perspective.